I'm going to speak about the flexible flat foot in children. الحقيقة أي واحد بيشتغل pediatric orthopedics هيكتشف إن one of the most common presentation and consultation in pediatric orthopedic clinic is flat foot and flexible flat foot in children. So to start with, there are different types of flat foot in children. The flexible flat foot, the rigid flat foot, and the paralytic one. Flexible flat foot means there is planovalgus foot, but flexibility means ability to reverse the flattening and reverse the deformity presence. And the ability and reversibility means that the restoration of the arch could be achieved by just dorsiflexion of the big toe, or leaving the foot dangling, or asking the child to tiptoe, and here the arch will be restored and the heel will go into varus. It is poorly understood. Why? Because although it is one of the most common causes seeking medical advice, but there is no consensus with whether flat foot represent a deformity or variation from the normal. So it's a very controversial problem regarding diagnosis. In a study in military recruits, more than 3,600 recruits, it was found that flat foot is a normal contour of a normal functioning, stable, flexible foot. And even in presence of any disability is not related to just the mere presence of flat foot, but to the lack of flexibility of it and the lack of flexibility of the foot. It is very common, it's rarely disabling, but the true instance is unknown because we don't have a cutoff point between what is normal and what is abnormal. Who is the child affected or diseased with flat foot? When you know that at the age of 2 years, we have 100% incidence of flat foot in a child, there is no disease with an incidence of 100%. So our understanding is, we have a problem in our understanding because 100%, there is no disease. It is a normal variant to have a flat foot at the age of 2 years. And at the age of 10 years, only 4% will have flat foot. This means that there is improvement of about 96% of flat foot over the first decade of life. So in most cases, flexible flat foot is a physiological, it's not a disease. The problem to diagnose it radiologically, that there is a lot variable, very wide variation of the normalities. So all angles measured or angles describes, there are very wide variation. Mostly are described in adults and not in children. So it is difficult to diagnose it from just the radiological appearance of the foot. There are two types of flexible flat foots in children. One, just flexible flat foot, and the other is flexible flat foot associated with short tender Achilles. And we have to differentiate from both, And the flexible flat foot with short tender Achilles represent about 25% of all flexible flat foots. The pathology of the flat foot, there is valgus hind foot, there is plantar flexion of the talus. In long-standing cases and the structural cases, there may develop supination of the forefoot over the hind foot. The shape of the foot is abnormal. There is sagging of the medial arch, loss of the normal medial arch of the foot, and even sometimes maybe convex medial border of the foot. Clinically, usually, in the most of cases, the child presents for the shape. The parents come and telling that the foot seems to have an abnormal shape. They are not happy with the foot appearance of their children. But at adolescence, they may develop pain, callosities, and we have to ensure that this pain is related to the flat foot. It's present in the medial arch, sometimes in the sinus tarsi, sometimes at the calf muscle and the tender Achilles. Of course, we have to examine the patient generally for laxity and the rotational profile of the lower limb. On examination of the foot, we have the, as I told you, the straight or obliteration of the medial arch, excessive valgus of the forefoot, and the out-towing and the external rotation of the foot. To test the tender Achilles tightness is very important to supinate the foot and to lock the mid-tarsal joint. Otherwise, you can achieve nice dorsiflexion, although there is short tender Achilles because of the excessive flexibility of the mid-tarsal joint. So it's very crucial to take the heel into slight varus to ensure that you are locking the mid-tarsal joint, and then test for dorsiflexion to properly assess the tightness of the tender Achilles. Assessment of flexibility by dorsiflexion of the big toe, leaving the foot dangling. It will reverse the arch, and asking the child to tiptoe, then the arch will be restored and the heel will go into varus. As I told you, radiological diagnosis is not that clear, and we have to diagnose flatfoot to do radiographs, standing weight-bearing radiographs. Otherwise, if it's not weight-bearing, the foot is normal. There is no disturbance of the mechanical alignments or the angles of the measured angles of the foot. But even if you find radiological evidence of flatfoot, this is not that important. The most important is the clinical assessment to know if there is pain, to assess the flexibility and the function of the child. And if there is no pain, good flexibility, there is no abnormality regarding and no impact on function, the mere presence of radiological evidence of flatfoot has nothing to do. So we have to have a clinical diagnosis of flatfoot. Then to plan treatment, there is a matrix of whether this deformity is symptomatic or asymptomatic, it's physiological or pathological. This integration will lead us to design or to plan treatment. So the treatment dilemma. There is no control trial till now that document avoidance of long-term pain or disability by prophylactic non-operative or operative treatment for asymptomatic flatfoot. مفيش لحد دلوقتي اي study تقول ان احنا لو عملنا حاجه دلوقتي سواء non-operative او operative اقدر اتحاشى او avoid ان يحصل اي problem او development of disability in the future. وكمان ما في no evidence that clinical and radiological flatfoot will cause disability in the future. ما اقدرش اعرف ان العيان ده او الشخص ده اللي عنده فلات فوت هتجيله disability، ممكن يعيش طول عمره كويس قوي بالفلات فوت وما يحصلوش حاجه. فعشان كده ده مهم قوي. هنعالج ازاي؟ طب وانا هعالجه in expectation of what؟ ده مش كده بس. Flat foot may be beneficial. In military recruits, the flat feet had significant less risk of stress fractures. ماشي؟ اقل من الناس اللي ما عندهمش flat feet. الأكتر من كده كمان زي ما قلنا 96% will improve over the first decade of life. So before deciding on treatment, the orthopedist must be carefully consider whether any treatment is even necessary from the start. We are not just treating the shape of the foot. We are not a plastic surgeon just to satisfy the parents by correcting the shape of the foot. And despite the absence of scientific evidence for derived benefits of treatment of asymptomatic flexible flat foot, but treatment and many treatments have been advocated for years, and still many treatments are advocated for asymptomatic flat foot. We have different modalities, non-operative modalities and operative modalities, many options. The most common, of course, are the medical shoes. Many describes medical shoes, medical shoe inserts, modifications of the shoes. مش كده، مش احنا بس كمان. The physicians, the pediatricians describe medical shoes for flat foot. But do they reverse the collapsed arch? There is no evidence whatsoever they do reverse the collapsed arch. Even if you put the child in a medical shoe and take an X-ray for him, they don't correct the malalignment of the foot, and even not effective in developing the arch with long-term use. There is no evidence that they will reverse the arch on follow-up. So they are not effective on treating the flat foot. There is a famous statement that the parents are usually anxious regarding the shape of the foot of their children. So why not to prescribe such modifications and such shoes to treat the parents? But this should be provided that we are not doing harm to the child. So do the arches and medical shoes are doing harm? The answer is yes. So in a study on Indians walking bare feet, they found less instance of flat feet when they walk bare feet, and the higher instance of flat foot when they use closed shoes. So just the mere use of shoes increase the instance of flat foot. In addition, the long-term use of arches will produce long-term psychological effects. They will produce dependency and even have an adverse effect on the development of the arch. يعني لما عملوا studies controlled follow-up and controlled studies and controlled comparative studies لقوا ان الاطفال اللي هيستعملوا medical shoes have delayed development of the arch على عكس اللي ما استعملوش they have higher instance of development of the arch, high percentage of development of the arch. So they are not of value, they are harmful, passing with the concept that they may be harmful. So what are the indication of treatment? The indication of treatment is painful flat foot. Don't touch painless, flexible, flat foot. In the presence of some indication of medial side callosities, and query indication is the excessive shoe wear. The general instructions when you have a flexible flat foot, to ask the parents to train their children to ask them to allow pair foot walking. يعني دايما تقول للطفل يمشي في البيت حافي. دي أحسن حاجة to strengthen the muscle. Because using any medical shoe or rigid or hard shoes make the muscle flail and make the muscles weak, and so this will maintain the flexibility and maintain the dropping of the arch and the flat foot. Ask them to train him for tiptoe walking and heel walking to strengthen the muscle. Heel cord stretching could be done in short tendon Achilles, but also we have to supinate the foot to effectively stretch the tendon Achilles. Otherwise, we are doing dorsiflexion and we are stretching the mid-tarsal joint. Although the shoe inserts are not helpful and there is no evidence they are effective, they are in common use. طب ليه in common use؟ ما السجاير harmful وبتستعمل وبتتباع وليها بزنس كبير. مش معنى ان الحاجه موجوده او بتتباع معنى كده ان ليها فانكشن او افكتيف. خدوا بالكم احنا بنتكلم على الفلكسبل ايديباثيك فلات فوت مش اي باثولوجيكال تايبس او باثولوجيكال انتيتي زي الباراليتيك بروبلمز. So they are not useful, not valuable, and even may be harmful. And actually, there is no evidence supporting their use for treatment of flat foot. The goal of surgery is to relieve pain, is not to reverse or to correct the shape of the foot. It's mainly to relieve pain. And in general, what are the percentage of flat feet or flexible flat feet that will need surgery? Actually, is rarely needed to do surgery for correction of flat feet. Again, surgery is indicated mainly in presence of foot pain. There are many procedures described. All soft tissue procedures considered to be failures, and usually there should be a pony procedure to correct the flat foot. The one outstanding the test of time and have real effect on restoring the arch and the correction of mechanics of the foot is the calcaneal lengthening osteotomy. It corrects the hind foot valgus, it restores the arch, decrease the pain, and the most important, it maintains the normal mechanics of the foot. So after correction, the subtalar joint is functioning normally. Calcaneal lengthening osteotomy have been popularized by Mosca, and it corrects, as I told you, all the components of the foot, relieve the pain, preserve the function, and theoretically, once you are preserving the function, then you are preserving the function of all other joints around the subtalar joints and decrease the incidence of developing any arthritic changes in the future. This is an example of 11 years boy with flexible, painful, flat foot, and then after correction, restoration of the arch, another girl with severe valgus foot, and here after correction with maintenance of the flexibility of the subtalar joint and correction of the foot. So to conclude, flexible flat foot is considered to be a normal foot shape that's present in most infants and many adults. The arch elevates spontaneously in most of children during the first decade of life. No evidence that longitudinal arch can be created in a child's foot by any external forces or devices. In shoe inserts and medical shoes may be even harmful for use, and sometimes they are the cause of developing pain. Flexible flat foot with short Achilles tendon may cause pain and disability in some adolescents, and we cannot predict who is the child who is going to develop this pain in the future, and we don't have any evidence that we can do something now to prevent the development of this pain in the future. Surgery is indicated in flexible flat feet with short tender Achilles when conservative measurements fail to relieve pain underhead of the plantar aspect of the talus. And joint preserving osteotomy, like the calcaneal lengthening osteotomy, is the fundamental and central procedure of choice. Thank you very much.